During my master's program, I really fell in love with the anatomy and the physiology, and then went on to do medical school, and I found my niche right there in the anatomy and physiology. As I did my rotations, it just kind of really helped me realize that as a general surgeon, I can provide immediate relief to patients when they're in trouble, and I get to build long-term relationships with my patients as well, especially ones that have cancer diagnoses, and I get to see them again and again and see them actually doing better and making a huge improvement in their life as well. And it's more than just the patients, it's their families too. In my general surgery practice, I do everything from placing feeding tubes all the way down to taking out the appendix, fixing hernias, as well as taking out the gallbladders that typically come through my door. That seems to be a majority of it, but we also treat bowel obstructions as well, and colon cancers, and any kind of obstructive process that may be coming along. The first time anybody comes in to see me, I've reviewed what most of the chart will tell me, but there's always key elements that are missing, and that is the persona of the person. I really try to get to know them as a person and what their goals are. Try to figure out what is that I can offer that's going to be in alignment with what they want to accomplish. And that's really the first meeting. And once we kind of establish that, we go forward with surgical planning, do the surgery, and then they come and see me afterwards, and we reassess, did we accomplish what we set out to do as our conversation had happened. It's good to get the patient's perspective on it, because what the chart says, what the images show, may not be what the patient's experiencing. And I want to treat the patient, I don't want to treat the numbers or the imaging that's showing up. I like to do medical mission trips, and as a general surgeon, I've been able to do that during my residency, and when I was in medical school as well. We went down to Guatemala. We were able to perform gallbladder surgeries, appendix surgeries, hernia surgeries for the rural community. My wife is also a physician here. She does endocrinology. We just had a daughter. She's 14 months, coming up at the end of February. It's been a learning process becoming a new parent for the first time. So it's a journey in and of itself. She's teaching us as much as we're trying to teach her.